Hey, welcome back, everybody. Listen, we're so glad you're with us, and we have some really important news to pass on. We will be talking about trips to the ER. Everybody remembers if that has been you, or you've had to take a family member, or it's a holiday and you've had to go. But the question is, are all trips to the ER true emergencies? Well, I'll tell you, common conditions that you may think are really not. Dr. Richard Vienne is back from Univera Healthcare. He's the Vice President and Chief Medical Officer, and we're going to talk about what a potentially preventable ER visit is. And I think we have a great graphic to show. Good morning. Nice to have you here.
Good morning, Linda. Thank you for having us.
Yeah.
And, in advance, happy Thanksgiving, to you and the viewers.
Thank you.
And let's keep it healthy.
Yes,
so.
Let's do that. All right, let's put the graphic up and talk about potentially preventable ER visits. But, take a look. These are reasons why people go. All right, let's talk about bumps and bruises, sinus infections, sprains and strains, abdominal pain, back and neck problems, nausea and gastro problems, headaches, urinary tract infections, joint aches and pains, ear infections. Why do we say potentially preventable?
Yeah, so New York State Department of Health kind of defines this as clinical conditions that could have been handled outside of the emergency room, or could have been handled if people had gotten their preventive care in advance or had seen a physician and addressed their symptoms early on. So it's potentially avoidable because if they had gone early and gotten seen, maybe these situations wouldn't have appeared.
Is this really a big issue?
Huge. Every year we see, for these 10 common conditions that you just listed out, about 2 million ER visits at a cost of $1.3 billion a year. And it's a big problem too because it causes a clog in the emergency room and people wait long times. I've had patients call me from the emergency room, I'm still waiting. Well, I didn't know you needed my help. So what's going on, and let's talk. So I think it's important for the viewers to know that they should probably touch base with their primary care physician to see where is the best place of care for them. Could it be the physician's office? Could it be an after-hours clinic? Could it be urgent care? Or could it be telemedicine?
You know, and some people just wait till the 11th hour. You know you're not feeling good during the day, but then you get, then it's the middle of the night and you get scared. Bang, you call 911, you end up in the emergency room when you could maybe, think about that. Call the doctor in the afternoon when they're still there.
Right, and that's to that potentially avoidable piece of things. If you got early intervention on that symptom, might it have been taken care of earlier before it became a crisis late at night? Yeah,
and folks, 2 million visits these conditions account for, or about $1.3 billion in healthcare spending, and 90% of that really could have been avoided. Plus, we talked about the ER. You don't really want to be there. It's the longest wait time and the highest expenses, including the out-of-pocket costs.
Right, so nobody likes to wait.
Right, especially when you're not well.
Especially when you're sick, exactly. So I'm not feeling well. I don't want to wait. I want somebody to take care of me. I want somebody to address my issue, right away. So if you can access other care in a different venue, you can get a more timely care and not wait as long and not be miserable. Because, quite frankly, a long wait, feeling bad, it's miserable.
And in this day and age, we can actually now start accessing telemedicine.
Correct.
And how do we do that? Because I know you can actually get a prescription through telemedicine too.
Yeah, so it's best to sign up with a telemedicine provider or check with your doctor's office because doctor's offices nowadays are doing telemedicine visits or televisits. So connect to your provider, check with your insurance company about the coverage for your telemedicine, but it's a nice little convenient way of addressing your issues, and especially with the bad weather. You mentioned the ice and snow and things like that. I can't get out of my driveway because I got too much snow in it, and you're not feeling well. That could be a avenue approach to get care.
You could actually be speaking with a doctor one-on-one. And get that prescription. That's amazing. Now, if this sounds really interesting to you and you've thought about this too and you'd like to know more about these potentially preventable hospital ER visits, all you have to do is go to our website. Go to Your Health Matters. That's a page at WKBW.com. We want to thank Dr. Vienne for coming in from Univera Healthcare.